In this video, we are going to learn about the gluteal region. Gluteal region, there are two layers in gluteal region, superficial layer and deep layer. In superficial layer, there are three muscles: gluteus maximus, gluteus medius, and gluteus minimus. So first of all, the topmost layer, gluteus maximus, and the gluteus maximus, it is the largest muscle of this region, and this gluteus maximus muscle, it originates from behind the gluteal line, behind the posterior gluteal line from the gluteal surface of the hip bone. This is posterior gluteal line, and this is the area behind the posterior gluteal line, which is gluteal surface behind the gluteal line of the hip bone, then the dorsal surface of the sacrum, then the sacrotuberous ligament, and the coccyx. These from these four areas, gluteus maximus muscle originates. From these four areas, gluteus maximus originate, and it gets inserted into the different regions. This is the iliotibial tract. Iliotibial tract is the lateral thickening of the fascia lata, and two muscles get inserted into it. One of those muscle is this gluteus maximus fibers. These gluteus maximus fibers, majority of fibers, they get inserted into the iliotibial tract, and then indirectly this gluteus maximus is attached into the tibia on its lateral aspect via this iliotibial tract. So again, gluteus maximus muscle, it gets inserted into the iliotibial tract, then its iliotibial tract, and then few of its fiber gets inserted into the femur on its posterior aspect. There is upward continuation of the lateral lip of the linea aspera, that is gluteal line. So this gluteus maximus gets inserted into the iliotibial tract and this gluteal line, and it gets origin from the part of the ilium behind the posterior gluteal line, dorsal surface of the sacrum, coccyx, and sacrotuberous ligament. Look at the muscle fibers and its direction. They run downward, obliquely, laterally, and anteriorly. So when they these muscle fibers, they contract, this origin pulls the femur towards itself, so that the femur is extended. Though they produce extension of a femur, and this muscle is supplied by inferior gluteal nerve. So here then comes the gluteus medius. Gluteus medius arises between the posterior gluteal line and anterior gluteal line, and look at its posterior gluteal line and anterior gluteal line, and look at its insertion. It gets inserted into the greater trochanter of the femur on its lateral aspect. Greater trochanter of the femur on its lateral aspect. So this muscle is supplied by superior gluteal nerve, and when these muscle fibers, they contract, they produce abduction of the femur, plus they also produce the medial rotation of the femur. Then we have got gluteus medius. Gluteus medius, it gets originated from between the anterior gluteal line and inferior gluteal line, and between the originated from the anterior to the anterior gluteal line and superior to the inferior gluteal line, and look at its insertion. This muscle gets inserted into the greater trochanter of the femur on its anterior aspect. Greater trochanter of the femur on its anterior aspect. So when this muscle, it contracts, it produces the medial rotation of the, now look at the medial rotation of the femur. This muscle is also supplied by superior gluteal nerve. Then we have got, this is tensor fascia lata. This muscle originates from the gluteal surface, just behind the anterior superior iliac spine, and downward it is inserted into the iliotibial tract. So iliotibial tract is the thickening of deep fascia on the lateral aspect. This iliotibial tract receives insertion of gluteus maximus muscle plus tensor fascia lata, and these two muscles indirectly they are inserted into the tibia, anterolateral aspect of the tibia, via tensor fascia lata, and this tensor fascia lata keeps the knee joint in extended position. Thank you very much.